Hello, my friend and supporter. Welcome to medical science class. As a student of medical science, I wanted to take flavor everyone. Hello, my friend and supporter. Welcome to medical science class. As a student of medical science, I wanted to take flavor every branch of medical science. What kind of things I do that is bad, that is not, that is real, and that is good work, that is not. As a Muslim, he Allah is the one and only creator, except Allah, all are creation, last and best messenger Muhammad. No, I'm supposed to be one corruption. Ya Alif Lam. I salute my 2020 students. Ya Alif Lam Lam. Hi Allah Shapil Lam Apil Lam Kapi. Now medical science class. What is science? Science is anything, any matter, any event, any problem, any occurrence can solve by logic, document, or mathematical with improvement with experiment. That is medical science. What is medical science? Medical science is the branch of science described elaborated about creation like Homo sapiens, human. What is the apply of medical science? By apply of medical science, you can remain healthy, wealthy, wise, and secure life. And health. One of the basic need is health and medicine for all. If you know that medical science, you not to do treat other people, you can treat you. And as a doctor, I can not see any patient, no problem. But past the medical science, the wealth is remain in me. By that science, utilize me and can as long as survive until death. And die come, if believe one and only creator, follow the rules regulation of one and only creator, no fear. That is the exam. I go to the forever life youth if pass the exam. One and only creator give me prize. Forever life, youth, happiness. What which want, knowledge, power, women, wealth, wine. Knowledge, creator give me the knowledge about creator. After death, I see the one and only creator. Then power, in my worksheet, creator give me prize, and that place give me the place like heaven. That place I remain power. Then woman, creator give me what I do for woman, and give me woman my soulmate cordially. So many money, so many time, so many wine or champagne for that woman. Now that woman creator give me, and woman already ready for me, cordially accept me as a husband. Woman, soulmate, pure love. Woman. Then power, knowledge, power, woman, wealth, already heaven wealth, and wine. And creator give me the shara, right of shara, drinks. All five things, those are those are human, and try knowledge, power, woman, wealth, wine. Creator give me that kind of prize after death. If I believe one and only creator, follow the rules regulation of one and only creator. Now my patient, those are my patient, and believe one and only creator and follow the rules regulation of one and only creator. Now no fear of about die. If you die, you go to the after death life heaven. And forever life you are, and forever happiness. Eagerly waiting for that, nothing else. Boyfriend. ठीक है sir. When my death came, I also go, no problem. That is exam. If you pass the exam, death exam, you go. For that reason, La ilaha illallah Muhammad Rasul, as a Muslim, try for that. And stop taking breathing. Those are normal, not COPD or lung disease, chronic disease. Normal adult human. Stop breathing and say La ilaha illallah Muhammad Rasulullah, 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 La ilaha illallah Muhamm মোহাম্মদ রসুল্লাহ ইল্লাল্লাহ মোহাম্মদ রসুল্লাহ ইল্লাল্লাহ ইল্লাল্লাহ মোহাম্মদ রসুল্লাহ ইল্লাল্লাহ মোহাম্মদ রসুল্লাহ ইল্লাল্লাহ মোহাম্মদ রসুল্লাহ ইল্লাল্লাহ মোহাম্মদ Now I went that's whatever that practice before die. But if you believe one and only creator, follow the rules regulation of one and only creator, those are no Muslim, no fear about die. Those are other religion, believe one and only creator, name like God, Ishwar, Bhagavan, Khoda, Mabud, Ila, Mahaprabhu, or other name or other code name. Don't worry. We creation not understand. One and only creator understand. Not fight for creator name, fight for understand. Now my fantasy about our medical science class, not gossip. In medical science, we see, I say the how hypertension controlled by hypotonic solution, hypertonic solution. In hypotonic solution, what happen? Tonic up balance, 0.5%, 0.9%, 0.9% sodium chloride solution is called isotonic solution or normotonic solution. Normal saline is isotonic solution or normotonic solution. If give more sodium chloride in normal saline, that is hypertonic solution. In hypertonic solution, 1% sodium chloride solution, 0.1% more, then 1% sodium chloride hypertonic solution. In hypertonic solution, what happens? Cell remain 0.9% sodium chloride solution involvement, outer involvement remain 1% sodium chloride involvement. What happens? Now cell for tonical balance release the fluid and go to the 1% tonical balance purpose 1% sodium chloride. Cell shrinkage. If cell shrinkage, cell fluid go to the blood, what happen? If blood volume raise, what happen? Urination come. If blood volume raise, what happen? If blood volume fall, what happen? If hypotension, come in non-hypotension. Hypertonic solution. Hypotonic solution opposite. In hypertonic solution, cell remain, for example, 0.9% sodium chloride solution. In saline, how much water you give in saline, normotonic solution? You give half, 60%, 40% even. Then now hypotonic solution. In hypotonic solution, what happens? Cell remain 0.9% sodium chloride solution. In outer environment remain 0.5%, for example, or 0.4, 0.5% sodium chloride solution. Now cell go to the tonical balance, fluid absorb and come in normatory tonical balance. Now if blood pressure rise, what happen? Blood volume reduce. Then if blood pressure rise, what happen? Blood volume reduce. If blood volume reduce, what happen? The cardiac outload before and after load reduce. If blood pressure rise, then blood pressure come in normal. Fine. By that solution you can apply normally in house. Now how hyper type 4 hypertension, type 3, type 2, type 1. Those are type 4 hypertension. That patient give advice, exercise, avoid salt and avoid more exercise, heavy exercise, and no more fat and balanced diet. By balanced diet take. Then the heart condition, ECG, echocardiogram, show the heart is normal, but blood pressure is type 4 hypertension. And type 4 hypertension, you see the drug like alpha blocker, beta, calcium channel blocker, diuretic, angiotensin converting enzyme converting enzyme blocker, angiotensin receptor blocker. You see the main book. And especially how treat the malignant hypertension. In malignant hypertension, the diastolic pressure above, for example, 160 and systolic pressure 200. This condition is called malignant hypertension. If you give calcium channel blocker orally, try to give orally. If not possible, then IV slowly. Understand? Half dose, then half dose. Then malignant hypertension correct. Now type 4 hypertension, what advice I say? Keep. Then what is the treatment? If you treat by calcium channel and alpha blocker or drug, 6 months go to that. When 6 months pressure come normal, then reduce the dose gradually 1/4, 3/4, then 2/4, then 1/4, then gradually reduce. Type then type 4 to type 3 come. First type 4 to type 3, type 3 to type 2, type 3 to type 1 hypertension come. Then gradually reduce the dose. Then type 1 to normotensive. Then you give the advice, follow the advice, and remain good without. That is the policy. But without cardiologist, without doctor, you don't do that. That is follow up. And you blood pressure will be checked up regularly check up your blood pressure, otherwise accident occur. I am not responsible for that. It is my one and only category, although not responsible. This not responsible. I am doctor, I know that, and those are doctor. And blood pressure check up by not pharmacist, by doctor, minimum doctor, MBBS, bachelor of medicine, bachelor of surgery. You give the royalty, then understand. I think better understand. Today is enough for medical science. Next we discuss elaborated about bodily. Understand? I think